Welcome back, and this has us talking here during the commercial break. At the beginning of the pandemic, most surgery centers were closed, but as things began to open up, more and more people scheduled non-essential surgeries, including cosmetic procedures.
Yeah, Dr. Stuart Linder is a board-certified plastic surgeon joining us right now to talk about it all. Thanks for being here this morning.
Good morning, and thank you again for having me.
Of course. No, we want to get your insight on this. First, for a lot of people are wondering, of course, during this pandemic, what you guys are now doing to keep things safe for you, your staff, and your patients who are coming in.
Yeah, there's multiple things that we're doing. The first thing is all the patients are pre-tested for the COVID virus 3 to 4 days prior to surgery. Okay. That includes a COVID antibody test. If that comes back positive, then they have the antibody, then we get an antigen test. And if that's usually negative, that means they've had the COVID virus and they're no longer infectious and they're safe to have surgery. So that's the key for the patients.
Yeah, I was going to say, some plastic surgeons say that their patients tell them that they're more aware of aging than ever before simply because they see themselves on so many Zoom calls there on their screen. What have you heard from your patients?
Right. Now, I'm a body sculptist, but the Zoom, definitely with the facial plastic surgeons, has had an increased surge in patients having facial surgery. As you say, they're looking at their face. They're seeing more of the details and the things they don't like. With respect to my practice in body sculpting, it's the self-isolation. It's the patients that are having remote living that have more of an awareness of their body image. Also, the inability of patients, men and women, to be able to work out, train, exercise has shown an increase in weight gain. When you combine both those factors, you have a tremendous upsurge of body sculpting surgeries.
So that's the thing. A lot of people are really upset about the gyms right now who were addicted to trying to stay healthy and be fit. So what are the big procedures, I guess the most popular ones that you're hearing about right now then?
Right. Excellent question. And what's crazy is the number of tummy tucks this year has been insane.
Really?
So tummy tucks, paniculectomies, which are huge tummy tucks, enormous, liposuctions throughout the body, including the thighs, and then breast reductions and breast lifts. These are all procedures to try to reduce the size of the body and make it more proportionate.
Real quick, before we let you go, because of COVID and, the safety precautions, with this honestly being a lot of non-essential procedures, do you ever tell a patient, you know what, you don't need to do this one?
Right. It's an excellent question. Absolutely. If a patient has comorbidities where they're at higher risk of getting an infection such as COVID or any other infection, or if they have diabetes, COPD, asthma, or anything that could put them at risk, we never would want to do an elective surgery to ever risk a patient's health. So absolutely, it's a great question.
Yeah, Dr. Linder, thank you so much for giving us insight. It's not something I guess I was thinking about, but obviously a lot of people are, and so we appreciate you explaining everything that's going on behind the scenes there. Happy holidays to you and your family as well.
I'm laughing because, you asking me, what I need to get done. But again, Dr. Linder, thanks so much. We appreciate it.
And Mark's response was,
nothing.
You can't fix perfection. Yes, that's what Mark's response was to that question. Take care.
Bye-bye now.
Okay.